In this exercise video, we're going to be going through a knee mobility exercise, which is going to help try to get a little bit of rotation at the knee joint, which is necessary for full flexion extension, full range of motion at the knee, and for all the functional tasks like walking and standing and squatting that the knee has to do. So get sitting the edge of your chair, 90-degree bend at the knee, and try to stack your ankle directly under the knee joint. So we're nice and neutral about the ankle and the knee. Then you're going to take your hands and try to stabilize just above the kneecap on the bottom end of your femur here. Because we're going to try to make sure that when we're doing the motion, this part of your thigh and leg is not moving. So hold on tight so that way it doesn't move as you're doing this exercise. Have something underneath your foot or wear a sock on hardwood floors to help it slide easier, or you can use a paper plate on carpet surface if you need to for that. So what we're going to do, once we have everything stacked, we're stabilizing the knee and the femur here. We're going to rotate our foot out to the side and then rotate our foot inwards. And you can see that I'm trying to make sure that all this motion happens at the knee itself and not with letting my femur go in and out. So if I don't stabilize here, then I'm going to want to do this, I'm going to want to do that. We got to make sure that doesn't happen. And we're going to rotate the foot like a windshield wiper in and out. It is okay if you lift up on the top of your foot and the toes a little bit to do this, but it is more ideal if you can keep the foot flat and do this here. Now we want to make sure that the ankle isn't compensating as well. So I don't want you just to do this with your foot. So it's not that we're doing an ankle in and out. We're trying to make sure that it's the actual knee joint. So if you can find that bony part of the front knee here, as we're rotating, it comes inwards, and as we rotate out, it goes outwards. That is getting that rotation at the actual knee joint instead of compensating at the ankle. So you want to make sure you go nice, slow and controlled, go as far as you can one direction, brief pause, and then go as far as you can the other direction, brief pause. If you get any sort of pain or discomfort with it, go within a pain-free range. We don't want this to be painful. If you get any clicking or popping, speak to your therapist to discuss if that is something to work through or to be concerned about. But most of the time, that's not too concerning. And sometimes if it's a little bit sensitive, sometimes adding a little bit of compression at the knee can be helpful. So if you gently press down on your top of your knee as you do that, sometimes that can help alleviate some discomfort versus just gently holding here.